We're here to talk about health care in this workshop, but it's much more than that. It's about protecting human life of every race amid attempts by the proponent of the culture of death, led by our president, to pass health care legislation that will demean the lives of the preborn, the infirm, and the elderly. We do not have a health care crisis in this country. We have a problem with the system of payment for health care. We all agree that we need to contain costs, but the quality of U.S. health care is the best in the world. We don't want to throw out the baby with the bathwater. It's not the free market that's the problem, but government manipulation of the free market. Now Mr. Obama wants to increase dependence on government in a power grab that is unprecedented and unconstitutional and will put our most vulnerable citizens at extreme risk. Let's briefly review history. I have a few more slides later. I'm not very good at the PowerPoint thing. A well-known political figure ran his campaign under the slogan of change. His party was swept into power and he assumed the nation's highest office. He supported programs that included redistribution of income and wealth, government control of the auto industry, nationalization of banks, and more spending on education and health care. He derided the people he felt were in control of the monetary system. He supported euthanasia and abortion of the unfit. Children were taught to sing his praises in the schools. That politician's name, of course, was Adolf Hitler. Not take comfort in the belief that fascism could not happen here. It is happening here and now. Fascism by any other name, as Dr. Huntoon said. No more euphemisms. Fascism is fascism. The killing of an innocent baby is called a woman's right to choose. The extermination of an elderly person is called death with dignity, especially in my state of Oregon. Some persons have said they have a poor quality of life. Really, kind of down in Texas, that'd mean they need killing, all right? Murder will be a part of any government health care plan under this administration. Under the Oregon Health Plan, where I live, I'm a native of Buffalo, New York, like Dr. Huntoon, but under the Oregon Health Plan, patients were refused cancer chemotherapy, but were offered $50 to commit suicide. What kind of thinking is driving Chairman Obama, Prime Minister Pelosi, and Comrade Reed? Mr. Obama once said, "I'm going to teach my daughters, first of all, about morals and ethics. But if they make a mistake, I don't want them punished with a baby." This is the moral sewage that is running our country. If we want to prevent socialized medicine, we need to be able to articulate the truth, and we must be able to show the lies propagated by the current administration. There has been no discussion about health care costs as a percentage of per capita income after taxes. Working families in the U.S. actually have more disposable income after taxes and medical care expenses than their counterparts in Canada and Britain. Interestingly, Mr. Obama doesn't mention this because it's not about health care. It's about subjugation and it's about control. The Obama, Pelosi, and Reed triumvirate keep trying to convince us that we have inferior health care. An article that appeared in the February 2005 issue of The Spectator, a British magazine, was titled, "Die in Britain, Survive in the United States." The author concludes, it's obvious that if you have a serious medical problem, your chances are dramatically better in the United States than they are in Great Britain. Despite much touted access to primary care, 4.1 million Canadians cannot get it. Canadians wait 18.3 weeks for treatment. An article appearing in the Heartland Institute noted that Britons already in the queue for medical treatment will wait 1 million years. A Liberal Canadian member of Parliament came to the United States for treatment of her breast cancer and went back to Canada to vote to continue that system that she ran away from. Natasha Richardson, well-known actress, died in Canada after brain trauma skiing, after she had to be driven 2.5 hours to a hospital over mountain roads because there was no availability of a helicopter. Dr. Rozek, the director of that trauma center, said, "Well, what do you expect? We don't have the same system that you guys have down there." Mr. Obama claims 47 million Americans are uninsured. It is a lie, and he knows it's a lie. 3% of the U.S. population is chronically without insurance compared to 1% of the universal Canadian system. A study by the Heritage Foundation found that of people who are effectively uninsured, i.e. those people who cannot get medical care, whether they're insured or not, 7.4% in Canada, 6.2% in the United States. Very, very similar. The father of socialized medicine in Quebec and Canada, Claude Costinguay, has disowned it. He says it doesn't work. We need an American type of system. There seems to be very little point in going to a system that we know fails, but that's the reason that Obama's doing it. He knows it's not about health care. So why are U.S. medical care costs so high? It's all about tomatoes. Now, you don't know what I'm talking about yet. I wrote an article, it appeared in the American Thinker, called The Government Subsidized $10 Tomato. You can look that up. It shows how we would end up with a $10 tomato. And how would that happen? Let the government get involved and start Foodacare and Foodicade, and you will see tomatoes go up to $10. Government intervention increases costs. Over 130,000 pages of Medicare's punitive regulations. And as Dr. Huntoon said, we have to deal with it, so the overhead costs are